You know, I think so often I'll say I come to talks like this or conferences like this, and we get very energized by what we hear on stage and hopefully inspired. But then we go home and we say, how am I going to put this into practice? And so as we thought about this panel, what we wanted to talk about a bit was, what can you put into practice, or what's practical out in our own places, our communities? So I have some questions for all of them, and hopefully we'll have a conversation. Let's just start with you, Lydia. How have you thought about humanizing bias? I mean, we all know that it affects all of us, or we all have it. How do you think about the humanization piece of it?
Right, so the humanization piece, as you speak, comes from that recognition. It begins with the recognition that we don't see things as they are, we see things as we are. And so we inherently, like Jennifer said, you have a brain, you have bias. And so that recognition borrows or brings to bear the need for us to have some level of empathy when we're engaging with one another. And that for us to be effective in the process of changing our personal bias and being cognizant of our personal bias, we have to be able to provide some level of a safe space and support for us to encourage introspection and self-reflection. Because the moment you shame people and condemn them, then they build a wall of defense. And so a quick example, like, work in Burkina Faso, when we, working with providers who, are trained on standards of care, but then still have, difficulties and express biases in serving young people. Instead of looking at them and saying, you should know better, our approach is let's have a conversation about, the fact that there could be times when you're conflicted, that your professional norms and your personal values at conflict, and how do you deal with that? And so we then bring ourselves to bear and create that ground of commonality, where then we tell them about our own struggles, and then they open up to us. So it's that level of humility, intellectual humility, and empathy.
It's interesting, I got to visit last year the program, I didn't know about your program before, in Burkina Faso, and I met with several of the women who were on screen, Flora in particular, and they were crying as they talked about the difference this training has made for them, because they said, we can think of specific girls that we turned away, and we wonder where they are now, and we think some of them are pregnant. And they know the difference it makes in their lives.
Absolutely.
Joia, you talk about data and what we measure, and I see the difference that data makes. It matters, right? And I've sat in meetings where we talk about, oh, there must not be that many adolescents in the world or in Africa who are having sex and who should have family planning. And now that we collect the data, it turns out there's almost 250,000 of them that want access to family planning. Talk about how, even for your own life, Joia, how has bias shown up for you as a Black woman in living in the U.S.?
So thank you so much. It's not lost on me that I sit here, as I know of, a sixth-generation American, right, Black person in the United States, in this very privileged space to talk about health inequities in the U.S. context, and how, despite income and despite being here a long time, it shows up in how we receive care, how we even as providers are treated inside of the hospitals. And the importance of knowing that if we are the shining star that other countries are looking at, and yet we're treating people who are Black, who look like me, poorly, and it shows up in our access to me having a preterm birth, right? Like, my training at a hospital that was named Confederate General just 20 years before I was training there. Those moments of understanding how racism and bias and not being counted and seen as fully human as a Black person in America is important for us to share with others around the world. So, because we cannot be the example for others until we share the importance of not valuing people differently, and the hierarchy of human value based upon skin color is not how we're supposed to treat each other, right? So until we do that globally and be the example in the United States of what a true global community can look like, we're not going to be the shining star that we call ourselves to be.
And Jennifer, you are working in communities and in education systems now with police departments on bias. Share a little bit about that work with everybody in the room.
Yeah, so I think one of the big successes that came for me was working with the police department in Oakland, California. And so I, along with a couple of colleagues, went there and sort of worked with members of the department to try to help them to reduce the number of police stops that they were making of people who weren't committing any serious crimes. And so, you know, how to do that, right? I think at the time, you know, they felt that they needed to make that many stops because the crime rate would just kind of go through the roof if they didn't stop these people. But we sat down and we actually, you know, when officers make a stop in Oakland, they're required to complete a form to say why they made the stop, the location of the stop, and so forth. And we just simply added a question to that form, which was, is this stop intelligence-led, yes or no? Right? And by intelligence-led, we mean, you know, do you have credible information to tie this particular person to a crime? So now, each time an officer sees someone, when they're making the choice, should I stop this person, they have to ask that question. And we found in 2017, before we added that question to the form, they had about 32,000 stops around the city that year. And in 2018, with the addition of this simple checkbox, those stops went down to around 19,000. And if you looked at the stops of just African Americans alone, 43% reduction in the stops of African Americans.
Wow.
Yeah.
Can I respond to that?
You're redesigning the system,
Yeah.
right? You're editing the code, and you're getting that people to, police officers to just stop and pause for a minute with real information, much like the images you showed us there of a young Asian woman who, if you ask her about her gender, she does more poorly on the test. You ask her about, is she Asian, she does better, right? So it's that pause, right?
Yeah, it's a change in mindset with that pause.
With that, for that person, because we all have the bias.
Right.
Talk a little bit about the connection here that you see with the health system,
Yeah,
Joia.
for sure. So because of the advocacy we've been able to do with the Black Mamas Matter Alliance and our work, we've been able to work with the Centers for Disease Control, which in the United States is really our main organization that counts and measures, right? And so really working on what I spoke about earlier, how we're not counting Black women or women in general when it comes to maternal mortality. And we added in the data racism as a reason for the death. Now, what that makes people, that's a strategy, just like getting birth control is a strategy. The goal is justice. The strategy is adding this inside of the code, inside of the platform or the technology. What that makes the committees have to stop and do is understand what racism even means, to have a conversation about what we would then do differently. Do we mean interpersonal racism? Do we mean structural racism? But at least adding that one moment in time, just like adding the question for the policeman, makes people have to stop and think. And then work through their own biases to come up with a solution that's best for everyone. So that requires advocacy, organizing, working with your structures that are in place, and we do that around the world, and hopefully we continue to do that work.
Yeah. I wanted to say too, in Oakland, it wasn't just the change in the mindset of the officers on the street, but it actually, there was a change in the mindset of the leadership.
Yes.
They started to ask themselves, well, why did we think, you know, that we needed to stop that many people, right?
Crime was going to go up, and it didn't, right?
Crime actually continued to fall, you know, as they were stopping way fewer people, and so it forced them to adjust their thinking around it. And for the first time, they started having these conversations about bias, and how does bias could bias be influencing the decisions we make in policing?
I love that how you're getting people to pause, and then you're actually using a mindset and some data, and you're doing it in this way with the police force, but then it's trickling up to leadership. But it's also why leadership matters, right? That what we see is, you say, in terms of role modeling, we look out and we say, can that person be a leader? We have to change our leaders at the top too, so they think differently top down.
Right.
You're also, in the humanizing that you do, Lydia, and your organization, you're also getting people to pause and get this mindset change. How did you start to say to yourself, I want to do this not just in Kenya, but what got you to open your mind and say, I'm going to do it not just in my country, but I'm going to do it in Burkina Faso and other places?
Well, yeah, so the intention of the Beyond Bias project and this initiative was actually to tackle this issue of bias, because bias is not a new thing. You know, for a number of decades, about 5 decades actually, we've been training providers. And so one thing we've learned is that training is not getting us to where we ought to be. The training is helpful and supervision is helpful, but then it's not getting us beyond where we need to be. So we launched this, this project to look at, globally, because we are in Tanzania to be able to inform East Africa, West Africa, Burkina Faso, and in Pakistan for South Asia. And we're looking for really new ideas, and we're coming up with creativity, using the human-centered design with our partner YLabs, on how we can really, cut this code of bias and what we can really talk to providers that is different and that is new. And what we've learned is that providers actually don't know what they're supposed to do. And there's such a desirability bias nowadays that you find that when you do a survey, a regular survey, as we've always done, providers will tell you exactly what you want to hear. And so they'll check the boxes, they'll tell you what you want to hear, but when the young person gets through the door, those 5 minutes of critical interaction, then the provider goes back to their own values, and instead of espousing or upholding the standards of care, they go back to their own personal values. That's why we learned that we have to help them, dig deeper and deal with their, deeper issues of, the conflict that they have within and the conflict of their personal values versus their professional values to really be able to address the issue.
When we were backstage, or just having known some of you over time, I know you've all faced bias in your own lives. And this is a heavy topic that we're discussing, but you're giving us a lot of reasons to think through it and how to think through it. Tell me, in the midst of some difficult work, what keeps each of you hopeful? You want to start, Joia?
Oh, sure. Yeah. So places like this keep me hopeful for sure. Having a global community that's connected, that understands the importance of working on bias and how we're all connected to each other, and that you don't have to have experienced it personally to have empathy for something, right? You could believe, you could have access and resource and still believe everyone has equal value and should have all the things that they're supposed to have to live. So that conversation of us being a global community is really important. So this keeps me hopeful, so thank you.
Jennifer?
Yeah, I think for me, so we're all vulnerable to bias, but we don't act on that bias all the time. So bias is something that can be triggered by the situations that we find ourselves in, and that makes me hopeful, right? Because the situations can change. That we have control, over those situations. We have control over whether we're going to stop and slow down, whether we're going to reflect. So those kinds of things. And I think also just meeting people who, who've struggled, they're struggling, they're fighting, and through the pain, they're still able to kind of come to the table and try to figure out how to, make a better way, and not just for themselves, but for the people around them, and that's really, really inspiring to me.
For me, what keeps me going is the resilience of the people we serve. I like to keep my mind with that girl in the village. And I feel like if that girl in the village, with all the odds that she has to face, still has hope, then I too can be hopeful. I too can be hopeful.
Yes, beautiful.
Right.
Just in closing, I would like to say, I think, we've heard a lot today about that hopefully is opening our own minds to bias and how we might redesign it in ourselves and in our communities. I heard many of you speak about turning inwards. And first turning inwards and seeing where we have own bias in our lives. I did a little reflection yesterday at the end of a very busy day and realized a place yesterday for me, it came up backstage where I had bias about somebody who was going on to stage, and where it came up in a meeting that I sat in where there was clearly bias towards me in terms of the topics that came up. And this is why we need leaders of all different types, and we need different types of advocates creating and designing new systems, talking about data in new ways, opening ways for these conversations. So please join me in thanking these 3 incredible women leaders.